It's 7:11 now. A recent report from the Susan G. Komen for the Cure Foundation shows that Connecticut has one of the highest breast cancer rates in the nation, with 136 cases per 100,000 women. But the good news is the mortality rate in this state is much lower. Here to tell us now about what this all means is Dr. Andrea Silber, oncologist and co-director of the Women's Cancer for Breast Health at St. Raphael Hospital. Good to see you this morning.
Thank you for having me.
This is alarming. Why? I mean, you hear that Connecticut has the highest rate of breast cancer in the country. Why this state?
Well, it's the second highest, so we're not quite up there.
Okay.
But I think there are a number of reasons. A number of the women in the state of Connecticut have some of the risk factors. They are more educated and therefore have children at later ages. Those are some of the reasons. But some of the other reasons are we do have good screening in this state. And when you look at the statistics, we're actually 35th in terms of mortality. So maybe we're detecting more breast cancers earlier, and that's the good news.
The reason that it's bringing down the mortality rate.
Yes.
Still, when it comes to women even getting mammograms, there's a lot of fear around that procedure in general because you hear that it's painful, it's uncomfortable. But then you weigh that against early detection. What's the advice to women?
I think that they just need to get their mammograms. If you have to psych yourself up or convince yourself that you're doing something good for yourself, it's really important to get them because early detection is our best weapon against mortality from breast cancer.
You were saying something really interesting, that because Connecticut is a well-educated state, a lot of women are career-working women, they have babies later in life. What is the correlation between babies later in life and breast cancer?
Well, the more children and the earlier the onset of menses, menstruation, the more chance they have of having an uninterrupted childbearing period of estrogenic stimulation. So childbearing interrupts that, and we just hope that women don't change their childbearing, but get screened.
Okay, and of course you have tips for women. There are people that are more at risk for this type of thing. What are the real tips for women?
Know your family history. Family history can help you determine if you need different kinds of screening, but remember, most women with breast cancer have no family history.
Wow.
So not having a family history doesn't clear you. That's one tip. Make sure you know your breast density. If you're told by your radiologist or your regular doctor that you have dense breasts, you probably need another test like an ultrasound or an MRI. And then there are the regular tips that everyone should follow. Follow a healthy diet, exercise, and do breast self-exam. Even though you may not find it that early, most women discover their own breast cancer.
And has the age requirement changed for when you should get a mammogram?
There's still some controversy, but you start at age 40. I mean, that's really the time that you start regular mammographic screening. And in the state of Connecticut, there is insurance coverage for people who are uninsured or underinsured starting at age 40 with the early detection program.
Well, I know there's a free screening coming up, right?
Absolutely. At St. Raphael's on Thursday, we're going to be seeing women who don't have insurance coverage to get free breast exams, and be there.
Free screening. Sounds good. For more information about how you can get involved in that free screening, you can go to our website at WTNH.com. We'll tell you where to go, what time to be there. It's incredibly important. All right, we're going to turn now over to Steve.